Hi, everyone. Welcome to our new viral world. I know a lot has happened in the fight against COVID-19 since the last episode, and I thought it would be worthwhile for us to discuss some of the basics in how to improve our day-to-day efforts to prevent infection and spread. To that end, I decided to start a series focused on tips on how to best and most efficiently use the tools that are available to us. And today I'm going to talk about how best to use hand sanitizer. I did first want to give a quick update about where we stand as of mid-July. I think as many of you know, there has been a spike and an increase in COVID-19 cases over the last several weeks. However, the silver lining there was that it appeared as though the death toll had continued to decline. Dr. Fauci had mentioned that there may be several reasons why this could be true. One of which was that the new COVID cases may be infecting younger people who are able to recover after infection, and therefore that did not contribute to the death toll. Another hypothesis is that it may be that we are protecting our elderly and vulnerable populations better. We're taking care of people in nursing homes better, and so we're preventing the transmission of COVID into the populations that are most at risk for dying of infection. However, the third hypothesis is that we were simply seeing a lag. We would begin to see an increase in the death rate after some time. I think as many of you know, there has now been an increase, recent increase in the number of deaths from COVID-19. It's important for us to continue to be vigilant, to protect ourselves, our loved ones, and our communities, and to really use the public health tools that we have available to us as best and efficiently as we can. And so that's why I wanted to talk today a little bit about ways that we can improve our use of hand sanitizer. So how does it work? So if you've ever been wondering how hand sanitizer works, the major ingredients are ethanol or alcohol or isopropanol. Either one of these works. And basically, when you're putting the sanitizer on your hands, that alcohol or ethanol can disrupt the membrane of the virus. And this leads to the virus extruding different proteins and viral RNA and prevents it from being infectious. So when should you use hand sanitizer? I think the most important point to make here is when not to use hand sanitizer, and that's when your hands are visibly dirty. If your hands are visibly dirty, always use soap and water. That's the best and most efficient way to clean dirty hands. However, hand sanitizer has its place, but it's important to use the right amount for the right time. Most recommendations suggest that when you're using the foam, you can put a golf ball sized amount on your hand. And when using the gel, you can put a half a quarter sized amount on your hand. You then want to rub all the surfaces of your hands. So the front and back of your hands and in between your fingers, you want to get every single area of your hands covered in the hand sanitizer. So this should take around 30 seconds. And you want to make sure your hands are dry at the end of it. Are all hand sanitizers created equally? The Centers for Disease Control have recommended that we use hand sanitizer with an alcohol percentage of between 60 and 95%. And a recent article in Emerging Infectious Diseases looked at the efficacy of different hand sanitizer formulations that have been suggested by the World Health Organization, which had a percentage of ethanol around 80%. And they found that there was a reduction in viral infectivity using these hand sanitizer formulations up to about 40% ethanol percentage. So we want to be as conservative as possible when we're thinking about the percentage of ethanol in the hand sanitizer we're using, as it may be that lower concentrations or percentages of ethanol may lead to an inhibition of the virus, but may not actually be able to kill it. For those interested in DIY projects, I left a few websites here for hand sanitizer toolkits that will allow you to make your own. I know this was very popular earlier on in the pandemic where there were shortages of hand sanitizer in stores. The recipe is fairly simple. It requires ethanol, hydrogen peroxide, glycerol, and sterile or distilled water. And for any kids out there, consult your parents before you decide to make it on your own. Thank you all for listening, and please subscribe below if you're interested in hearing more COVID-19 tips. The next episode will be discussing how to clean surfaces and reuse masks. Mask usage is really one of the cornerstones of the public health measures that we have at our disposal to help protect ourselves, our loved ones, and our communities from COVID-19 infection. And I'd like to add my voice to those who are imploring everyone to continue to use your masks as the number of COVID-19 cases begins to rise. Thanks.